Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Being with a visible disability, people can look at me and know that I have a disability and understand oh, I might need help. For people with migraine, they don't really have that luxury.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. Hi, I'm Joe Koh, Director of Education Digital Strategy at the Global Healthy Living Foundation and a migraine patient for over 20 years. I'm here with Sam Kelokates. He's the founder of Kelos Physical Therapy. He specializes in the treatment of headache and migraine in his patients. Outside of his professional work, Sam is a congenital amputee and athlete, and his unique life experiences help him relate to migraine and headache patients. I'm really delighted to have Sam on the show today. So Sam, how are you feeling today?
I'm doing great, Joe. Happy to be here. Thanks for having me.
Amazing. So I learned that you lived with tension headaches. Can you describe what a tension headache feels like for you?
Yeah, for me at the time when I was struggling with tension headaches was right at the end of PT school and through the first couple of years afterwards. For me, the tension headaches would usually start kind of somewhere in the morning with upper shoulder and neck pain and gradually progress throughout the morning into the afternoon, right up over the ear into the eye, and just kind of be a very dull ache and not a lot of pain, just mild, sometimes moderate if I let it go too long before taking any NSAIDs or laying down for a few minutes. So, but at one point it was happening enough to where it would be 4 or 5 times a week for me.
What made you specialize as a PT in headache and migraine?
In 2021, I decided that I wanted to open my own practice, and I just started seeing a couple people on the side while I worked a home health job. And then I started seeing a couple friends for headaches, varying from tension headache to cervicogenic headache, and a couple of migraine people. And I started using those treatments on myself and other family and friends. And it just spiraled into me seeing that there was a need for this and that there wasn't really a clinic that they felt that they could go to that said oh, we work with people that have, headache or other orofacial pain disorders, and that there was an opportunity here in the community that people really needed help with.
I was drawn to interviewing you based on a tweet that I saw that you put out. And I'm going to read it and ask you to explain what you meant by it. So you tweeted, migraine has been described as a sensory processing disorder. Another reason I strongly encourage exercise for those with migraine, as it has been shown to improve sensory processing. This can result in less frequent attacks by decreasing sensitivity to certain stimuli. Can you explain that, Sam? I think that's super interesting.
Yeah, so with one of the theories with migraine is that there is so many sensory stimuli involved, from visual, auditory processing, vestibular, and touch, so in our somatosensory system, that there's so much going on. We're having difficulty with processing and integration of these sensory stimuli. And that's been shown in both children and in adults with migraine. So there tends to be this hypersensitivity to these various stimuli that are present both during and between attacks for people with migraine. So the way, in that I said exercise, it doesn't necessarily have to be exercise. It can be multiple forms of movement, from walking to running and biking to yoga or doing housework. But physical activity is really good for helping our body process these sensory stimuli better. And over time, especially with exercise and the way it can be dosed, can help our body create new pathways to make these connections stronger, to decrease how frequently they make you trigger into a migraine attack.
Really helpful, and I appreciate that you define exercise a little more broadly, because a lot of folks, when they hear exercise, they think of intense aerobic activity, and walking is a form of exercise.
Yeah, and I think so. When I say exercise, I mean it's kind of like medication, where there's a specific dose, there's how much time, there's a specific intensity that we work at, and we're really working on controlling the volume that somebody is doing, one, to not trigger an attack, but also to modify their disease so that it occurs less often. It can be varying for different people depending on what their needs are at the time, and also what they enjoy. So when I say exercise, I don't want people to think oh, you have to be running down the street doing, high intensity CrossFit style workouts. That's not what people need all the time. For some people, if that's what they want to get to, I can help them get there. But that's not necessarily what people need to make sure that their disease is improving.
And how do you talk about exercise with people that are in pain, that are living with migraine? That's one of the last things that we want to do when we have a migraine attack or are dealing with the ongoing implications of migraine.
That's a really good question. So for it really varies on the person how they perceive exercise and movement and what the purpose of it is. So if they have kinesiophobia, so they're fearful of any type of physical activity will trigger an attack, I really work with them on finding something they enjoy and working towards that so they're less fearful of that movement and can feel more empowered living with a chronic pain condition. Now, sometimes being in pain, exercise can actually really help that because it does modulate our pain perception. So it can actually decrease how much pain you're feeling at one time. So make you feel less intense pain. But it also helps us increase our thresholds of pain. So it requires more stimulation to induce an attack or high levels of pain. So I really work with trying to teach people how does exercise and movement affect pain? And how does that in turn make your life more functional or give you more abilities despite your chronic pain condition?
I think it's such an important topic. It's something that we touched on a little bit with a previous guest, Dr. Lindsay Weitzel, who talked about when she has a migraine attack that she tries to distract her brain by watching a movie or even listening to a movie if you couldn't watch it to
Mhm.
get rid of the in your head dwelling on the pain, which is really hard to do. And exercise is another way that I'm hearing you say that we can do that.
There's not really much research on using exercise to treat an acute migraine attack. There's really just very small case studies. But I've had several clients over the past that where they're like, if I feel a migraine coming on and I go for a light walk, 20 minutes, just easy, not even at an intensity where it would create like a physiological demand to improve cardiovascular fitness, but just to be a little bit active helps to decrease their migraine, get it to go away quicker, or to abort it before it really sets in with the head pain phase.
Yeah, super interesting and definitely more research needs to be done. I want to switch gears a little bit. Can you talk about some non-pharmacological approaches to migraine management that you discuss with patients?
Yeah, so there's a wide array of non-pharmacological interventions that we can do with people, exercise being one of them. Other things you can look into with patients would be like nutraceuticals using like vitamins and minerals to treat the disorder. And there is some evidence to show that things like riboflavin, CoQ10, and magnesium are really important for migraine. Those substrates are kind of used in our metabolic pathways. So, and we know that with people with migraine, that there shows to be mitochondrial dysfunction during and after migraine attacks. So, because of this energy deficit, that might be one of the reasons people have problems with sensory processing. Because sensory processing requires a lot of energy from the brain. Other things we can do for non-pharmacological treatments would be to, really look at the diet outside of the micronutrients, but are they eating enough, regularly enough? Are they consuming enough water often enough? Because sometimes they don't even really have to get to like clinical levels of dehydration, but to be lower on the side for them might be able to trigger an attack. And we can also look at sleep patterns and stress management. And stress management doesn't always mean that like somebody is in emotional distress and we need to address that with a mental health professional. Sometimes stress management is just like, oh, I have, multiple meetings today. I got to run the kids around. I have, this PTA meeting after school. I got so much going on that just creates a higher level of stress. Well, how do we manage that to get you back down and more grounded so you can feel more in control?
I want to really drill down on some stuff that you're saying because a lot of that has been used against migraine patients, and you're a super caring man and are very empathetic. How do you cut through the dismissiveness that, oh, if you just drank more water, your migraine would go away, which actually was told to me in a medical setting when I was in a horrible attack. And I'm like, the water is not, might help. It's not going to help now. How do you get through to people that have been harmed by saying just exercise, just as if that's a small
Yeah.
thing, or just drink more water, and these things that we know can be helpful?
When I really talk with my clients about like these non-pharmacological treatments, I don't want them feeling like, oh, they're to blame for their condition. There's things you can do to help influence the disease and have migraine attacks occur less often, but that doesn't still mean that you still don't have migraine disease and that you have it built up sensitivity to these deficits where yeah, I could be dehydrated and not get a migraine. but you do. So we just need to recognize that that's a symptom for you. And how do we prevent you from getting to a level of dehydration before an attack occurs? Because drinking water during the attack isn't going to help you abort it any faster than you taking the medication or you going and lying down. Yes, we need to rehydrate so those symptoms go away and help you feel better, but it's not really your fault all the time. I mean, there's so many different things going on. You could be, busy at work, distracted in meetings. You can't always drink water constantly at times, but it's about creating a management solution to help you avoid that trigger in itself.
I think that's really helpful. And I think that you living with a visible disability, being an amputee, has really helped you create empathy and a connection with people with invisible disabilities. Can you talk about how that has informed your practice?
Being with a visible disability, people can look at me and know that I have a disability and understand like, oh, I might need help. But on the other side, they might also try to help me when I don't really need help. For migraine people or people with migraine, they don't really have that luxury of saying like, oh, clearly this person needs help or they need some type of accommodation or change in their life to where I can facilitate, their disease and make life less stressful on them. So some of the ways I kind of can talk with people about it is like, I have a physical disability. People know when I need help. For you, people might not know when you need help and you might have to ask for it or set clear boundaries on when you might be having an attack on what is okay for people to do and what is not okay for people to do. Some people are clearly triggered by smells from perfumes. And if you're working in an office or working with somebody that's always having a strong perfume around them and you're constantly getting triggered, it might be appropriate for you to really have that conversation with them. It's like, look, I know you really like that smell, but for me, it's really causing my disease to worsen around you. Either we need to modify what we're doing and how we're interacting, or could you please stop wearing that for when we're going to be working together?
Yeah, that's super helpful. What are some practical physical therapy tips that most people, and I know it's very individualized, could benefit from hearing?
I think for people with migraines, and it's a little bit different when you get an attention headache and cervicogenic headache, but for migraines, I think a lot of people overstretch their necks. I don't actually think stretching is necessary for a lot of people. They have that neck pain or shoulder pain and they feel that migraine coming on, and they spend a lot of time trying to stretch that neck pain away. But what they're probably actually doing is actually irritating the tissue there and sensitizing the area even more. And then they're making it easier to trigger that migraine from a musculoskeletal trigger. What I really find is more effective is low intensity cervical strengthening exercises, enough to not stimulate, intense muscle contraction that might make the migraine or headache worse, but will end up making the muscles stronger and feeling more stable with the neck.
Listening to you speak, Sam, it's so important for our listeners to understand that there are so many different tools in the toolkit, to overuse a metaphor, that we have when living with a chronic disease. And it's so fascinating to look at it from your perspective, which is one that many of us don't for many reasons. And I think it's important that we are open to hearing different approaches to managing what is for many of us a lifelong condition.
With those kind of strategies in the toolbox, you're saying there's so many different types of interventions, from manual therapy to exercise, both specific to the neck and head, to just generalized fitness and improving your overall wellness, to the use of non-pharmacological treatments like sleep and stress management. All these are tools, and the tools we want to use are very unique to each person. I can't just throw out different treatments that are, oh, that'll work for all migraine people. That's not how that really works. I need to, really sit down, talk with that person, hear what their story is, so I know how to modify the treatment plan that's optimized for that individual.
How do you work with other healthcare providers that are managing the medication aspect of migraine disease?
So one of the ways I work with some patients on figure out how to best manage their condition. Medications are very important for preventative and acute treatments of migraines, especially the attacks, and trying to reduce them and make sure that they can get back to living their life within that same day. What I'm working on is helping make sure that those medications they're taking, one, they don't have to take them as often, and they're more effective because you're able to get out of those sensitized states much quicker. So by using exercise, improving sleep hygiene, and improving stress management, they're decreasing their sensitivities to a lot of these sensory stimuli we talked about earlier that will help their medications work more efficiently. So there's actually a decent amount of studies, mostly in the aerobic category, not so much the strength training literature right now, but with the aerobic programs, that people that are in those programs that are taking medications end up taking less medications than their control subjects in those studies. So that's really how I view the role of physical therapy or exercises to augment the pharmacological side and make that side more powerful.
Yeah, that's an important message for people to hear. What do you want the world to know about migraine and your work in PT?
So the one thing I think, people, the general population should know is that when people have migraine, they're not making that up. It's a real pain disorder, and just because they don't show it in their face doesn't mean that they're not really suffering behind that wall of this invisible disease. It's not like some other chronic pain issues where you can see the injury that it's going on, and that those people need to be empathized with, and we need to understand that they're going through something that you can't help with all the time. From a physical therapy standpoint, like the majority of physical therapists don't understand what migraine is, or cervicogenic headache, or even tension headache. They don't really understand the pathophysiology. And I'm not just like assuming that. Like there was a study that took a survey of like 350 orthopedic physical therapists across the country, and like I think like 52% were able to like appropriately diagnose cervicogenic headache, and it was even less for tension headache, even less for migraine. So we get into these professionals that just aren't properly trained for the most common pain disorder in the world, or one of the most common pain.
Can you define those types of headache? Because our audience might not know.
The cervicogenic headache would just be defined as your headache is due to a cervicogenic trigger, where you clearly have neck pain and that's clearly leading to the headache attack. That's going to be absent of your other migraine symptoms, right? So it's just neck pain, just headache. But then there's a lot of overlap between that same symptomology and tension headache. So when I see people with cervicogenic headache or tension headache, it's kind of like the way I treat them is basically the same. I try to identify the musculoskeletal impairment that's present, and then make the treatment that addresses those impairments, while trying to control for pain that's initiating the cause of the headache. Now with migraine, when they have that neck pain is a referral from the trigeminal nerve. And then I kind of equate it to like how people have heart attacks and they'll have jaw pain or shoulder pain or arm pain with that there's this referral pain pattern where there's this oversensitization and stimulation of the trigeminal cervical nucleus, and that is referring pain outwards. And so that's where you're having this pain or this change in the brain, but it's referring pain to the head and the face and the neck. And that's where like, oh, I don't have a place on my head or face that hurts. It's just generalized. It's not very specific. When I'm evaluating someone with a cervicogenic headache, it's very easy to touch a specific area and generate that same exact headache pain.
That made me think of something you said earlier, which is going to be, I think, a lightning rod statement that we're overstretching our necks.
Well, so there's a difference between like actively moving your neck, like, oh, it feels so tight and I can't move it, and doing like active range of motion to kind of restore your ability to move the neck, because that's more of a perception issue. You feel like you can't move it, right? So you might be like stuck and can't move it, but then I go and rotate your neck myself and I can get to full end range of motion, no problem. That's more due to your proprioception and how you feel that you can move and stabilize your neck. And we can work on that by just actively moving the neck and slowly pushing into those ranges of motion. With somebody with an actual impairment, you won't be able to move your neck. And then when I go to try to move it and see how far you can get, I might be able to get a little bit further, but I'm going to hit a stopping point, or a point where you're really in a whole lot of pain because I moved your neck in that direction. That shows me that there's probably more likely that you have a musculoskeletal impairment that we need to address.
This was fascinating. Thank you, Sam, for joining me on Talking Head Pain. I'm sure that our audience will learn a lot from the conversation.
Thanks for having me, Joe.
Thank you so much for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.